Hey, good afternoon and welcome to FHCA's webinar, How to Be an Inclusive Leader, Your Role in Creating a Culture Where Everyone Thrives. I'm Kristen Knapp, Senior Director of Strategy and Communications for Florida Healthcare Association. I'll be your moderator for today. And our presenter is Dina Proto, the founder and CEO of Equity Healthcare Consulting. Before we get started, I want to go over a few housekeeping items. To help our program run smoothly for you, we want to remind you all attendees are muted due to the large number of participants. We encourage you to use the computer audio rather than a telephone to maintain today's sound quality. And we want to encourage you to ask questions throughout the presentation by typing your questions into the question box. And the slide that you see now shows you how to submit those questions using the question box. This webinar is being recorded and an online archive will be available on the FHCA website along with any additional handout materials. We've also have them posted to the Florida Care for the Aging website. So please encourage your attendees who are unable or your colleagues who are unable to join us today to view the recorded webinar. Today's program is brought to you by the Caregivers Florida Career Program, which is the CMS-funded grant that FHCA's Education and Development Foundation is sponsoring in partnership with the Agency for Healthcare Administration. As a reminder, this program gives providers access to free resources that includes connections with job seekers, job postings, recruitment promotion materials, and educational webinars like today's program. If you're participating as a nursing home member, we want to remind you that we do have a free employee satisfaction survey as part of this program. And that survey deadline has been extended through March the 27th. So we just sent an email about that yesterday. So we encourage you to take advantage of this free seminar, this free survey, send it to your employees. We've got a lot of great resources that you can use to make it easy for you to communicate about the survey. And it really helps us develop important projects and programs related to this program, including our ability to give webinars like the one you're going to be participating in today. So with that, we are ready to get started. And Dina, I'll turn the program over to you.
Great. Thank you for having me, Kristen. And hello, everybody. So today's topic, how to be an inclusive leader, your role in creating a culture where everyone thrives. As a leader, you all know how challenging it can be to recruit and retain quality staff in this post-COVID era. And you're probably aware that by 2025, yes, in just 2 short years, the healthcare industry will be short somewhere between 200 and 450,000 nurses. So just how do you continue to recruit and retain the best of the best to care for the people that you serve? Understanding your role in diversity and inclusion can assist you in improving employee engagement, recruitment, and retention strategies. So our objectives today: 1, describe what DEIB is and how it impacts healthcare organizations. 2, identify 3 ways that diversity, equity, and inclusion improves employee engagement, recruitment, and retention, and define leadership's role in DEIB. Along the way, we'll also discuss the importance of creating a sense of belonging for all employees, building diverse talent pipelines, and providing equitable opportunities for career growth and development. So how will the nursing shortage impact the industry? So there are several ways as we begin to continue to care for the folks within our long-term care and assisted living facilities. And we rely on those nurses to provide that care for our residents. Without enough nurses, nursing homes may struggle to provide quality care, leading to increased risks for residents, including falls, infection, and other healthcare issues. So we have difficult time at times recruiting that staff that we're looking for, and it can lead to increased staffing costs, challenges in maintaining adequate staffing levels. Now, how many of you have had the staff shortage on a day-to-day basis, right? You come in and you think you're fully staffed, and then you find out you're not. And sometimes that's because illnesses and emergencies happen. Sometimes it's because our staff's not fully engaged and present with us. So to address the nursing shortage, nursing homes and other healthcare organizations need to take steps to recruit and retain nurses, such as offering competitive salaries and benefits. We all know that, and sometimes we can't change those variables, but we can change other things. We can change and improve the culture and the environment that people work in, and the culture that we create within our nursing home or long-term care facility. And we can promote diversity, equity, and inclusion in our workplaces. That attracts more diverse range of candidates. So when we have a broader pool of people to pull from, we're able to attract different trains of thought and different skill sets. Efforts to address the underlying causes of the nursing shortage, such as improving working conditions and supporting nurses in their roles, will be critical in ensuring a sustainable nursing workforce in the future. So diversity, equity, and inclusion and belonging, DEIB in short. It's an approach to creating workplace culture that is respectful, welcoming, and supportive of all employees, regardless of their differences in terms of race, ethnicity, gender, sexual orientation, age, religion, disability, and more. In healthcare organizations, DEIB is especially important because it helps to build a more diverse and inclusive workforce. Healthcare providers can improve their opportunities by being able to relate to and understand the diverse backgrounds and experiences of their patients. So we have a diverse workforce. We understand more inherently, naturally, the experiences of the people that we're serving. If there's a disconnect between the provider and the resident or the patient, we might not fully understand what their lived experience is or what their needs are. We talk about individualized care plans and meeting people where they are. I had a physician one time say, well, we treat every patient the same. We should treat everybody with the same level of respect. However, we should individualize our care and treat people according to what their identified need is, not what we're comfortable with. Sometimes that's a challenge. When healthcare organizations prioritize DEIB, they can create a workplace culture that is more inclusive and welcoming to employees of all backgrounds. Studies show this can lead to better employee engagement, recruitment, and retention because employees are more likely to feel valued, respected, and supported in their work environment. For example, a workplace that values DEIB is more likely to have diverse talent pipelines, which can attract a wider range of qualified candidates. Employees who feel included and valued are also more likely to be engaged in their work and committed to the organization. That improves your retention rates. DEIB can also improve patient outcomes by increasing access to care and creating a more patient-centered approach to care delivery. And as a nurse, I do believe that when we feel like we are succeeding in providing optimal patient care and patients are having, or residents are having good outcomes, I feel like I've accomplished what I set out to do in my career. I feel like I did a good job that day because I was able to help that patient's quality of life improve in some way, shape, or form. DEIB also increases comfort and trust from the patient or resident perspective. So when they feel that they're represented and understood, there's a greater sense of trust. In short, DEIB is a critical aspect of building a diverse and inclusive workplace in healthcare organizations. And creating a culture within your organization, it's an intentional step. You can choose to not intentionally create a culture. The culture will still evolve. However, when you create and foster a culture of inclusion, then you're controlling the environment and you're controlling the growth that you can bring in and the talent pool, and you're intentionally controlling the patients and residents that you can pull in, and you're intentionally facilitating your retention along and long-term perspective for all of your employees. So if those are the positives, what are the risks of not improving diversity, equity, inclusion, and belonging? Well, a lack of DEIB can lead to reduced employee engagement and morale. So employees who feel they're not valued or respected in the workplace are less likely to be motivated and engaged in their work. That can lead to low productivity, increased absenteeism, and higher turnover rates. That results in staffing shortage and higher costs for recruitment and training, as well as potential negative impacts on resident care. How many times have you had to have leadership step out onto the floor to provide some measure of care because we didn't have enough staff out on the floor? So-and-so wasn't engaged and didn't have enough buy-in to come into work that day, or there's lackluster productivity. And we all gauge and work our industry, whether it's in nursing homes or hospitals or home health care or hospice, we all gauge how productive we are based off of how many people we can see and in what time frame. And it's all about the residents that we can serve, right? So the lack of DEIB can also impact the quality of care that the residents receive. For example, if nursing home staff doesn't show up or doesn't appreciate the culture or linguistic needs of a particular resident, that can lead to miscommunication and misunderstandings and inadequate care. Not intentionally, it just can happen. So how do we prevent that? Well, if I have one lived experience and somebody else has a lived experience, we can share that experience, or we can lead by example. We can share our best practices within each of our identities and how all of the ways that we identify, and that of our residents. Additionally, a lack of diversity in the staff can limit the ability of the nursing home to provide culturally responsive care to residents with diverse backgrounds and experiences. So if we pause here for a moment, have you experienced that in your facilities and where you're caring for people? Have you seen that play out intentionally or unintentionally? Or maybe somebody unintentionally projected their own thoughts and experiences onto another peer or another resident. And how might that play out for those folks? Finally, a lack of diversity, equity, inclusion, and belonging can lead to legal and reputation risks for facilities. Discrimination, harassment, and other forms of bias can result in legal claims, fines, and damage to the organization's reputation. Sometimes it can negatively impact your surveys and which tags, right? So, and I think we talked about that last summer at the annual conference, and I think it plays out in terms of what does quality care look like for one person is different than it looks like for somebody else, and individualizing that care again. Sometimes nursing homes that don't prioritize DEIB can be perceived as unwelcoming or hostile to certain groups of people, and that can negatively impact their ability to attract and retain residents, employees, and other stakeholders. In summary, nursing homes that do not prioritize DEIB may experience reduced employee engagement, morale, lower quality of care, legal and reputation risks, challenges in attracting and retaining residents, employees, and stakeholders. So what are the 5 key impacts of diversity, equity, inclusion, and belonging? We've been talking about them a little bit along the way. We've already talked about employee engagement and increasing them. DEIB can foster a sense of belonging and create opportunities for them to continue to contribute and grow with the organization. So it might even impact somebody's opportunity to move up in the organization and advance career-wise. Diversity, equity, inclusion can attract a wider range of qualified candidates to the organization and a diverse workforce that brings unique experiences and skills. In terms of retention, what does the cost of employee turnover actually cost the organization? Is it more cost effective to retain the employees that you have? Or is it constantly replacing and hiring, recruiting, training? How long do they need to stay with the organization in order to reap the return on your investment for that upfront starting of hiring and placing them in your care, right? How about increasing access to care? When healthcare providers understand and respect the diverse needs of their patients, they're better equipped to provide high quality care that meets those needs. And we can improve patient outcomes and increase access to care for underserved communities. So depending on where your facility is located, you might need to be paying attention to that and making sure that the residents within your local community or potential residents within your local community and employees have representation within your staffing model. Creating a patient-centered approach to care and delivery prioritizes the needs and preferences of patients. So how might that play out from a clinical perspective or from a social perspective? Well, from a social perspective, if we are not paying attention to the diverse needs of a resident, then or staff, it might impact that person's engagement. Maybe that person, I can give you a perfect example. A nurse is working and the resident wants to know, how is she doing? How is her family this weekend? What did she do fun? How long has she been married? How many kids do you have? The next logical question is, what does your husband do? Well, how does that staff person respond if they don't have a husband, but they have a wife? Do they need to be fearful of their position within the organization if they share that, or can they share authentically? And the same is true of residents. When residents come in, do they feel like they can share who is important in their life and not fear being judged, or not fear having a delay and maybe a call bell or not being changed appropriately, things like that. They're real things, and we don't think about it because if we've not experienced it, we just go through our day. But there are subtle little times throughout one's daily experience, resident or staff, where they might feel like they can't share that part of their identity because they're concerned. And so if we're creating a culture where diversity, equity, inclusion create a sense of belonging, and we value that, then people feel safe. When you create psychological safety within your organization, people want to be there. Sometimes that safety is more important than the dollar you can provide them in their hourly rate. Any questions so far? If you have questions, please post them in the Q&A for us. So what is the impact of diversity, equity, and inclusion on an organization's finances? Well, reducing costs. High turnover rates can be costly for healthcare organizations because it's time and resources to recruit and onboard and train new employees. Improving retention rates through DEIB can help reduce those costs. Increasing revenue. So if we're able to improve patient satisfaction or increase patient referrals or resident referrals and expand our patient population, then we've impacted our top line revenue. Engaged employees are more productive and innovative. and they're committed to the goals and the values of the organization. That can lead to improved performance and sometimes financial outcomes. What about an engaged employee who has come up with a suggestion or a recommendation that you haven't thought about because they have a diverse background from you? That can only improve your organization. How about the reputation of the organization, right? So we're more likely to be viewed as positively impacting employees, patients, and the community when we have a priority of diversity, equity, and inclusion. When you have community trust, that fosters loyalty and support. So I guess the question is, what's your role as a leader in diversity, equity, inclusion, and belonging? And how do you create that culture within and throughout your organization? So as the leader, you need to champion and prioritize DEIB initiatives and model those behaviors and values that promote a more inclusive workplace. That starts with empathetic leadership. It's a style of leadership that emphasizes understanding and compassion and connection with others. Empathetic leaders are able to put themselves in others' shoes, listening actively and responding to with sensitivity to the needs and concerns of others. They recognize and value the unique perspectives and experiences of their employees and work to create an environment where everyone feels heard, supported, and included. That helps you as the leader to better understand and address the needs and concerns of your workforce. By practicing empathy, leaders can build stronger relationships with their employees, foster a sense of belonging and inclusion, and create a more positive and supporting workplace. They're more likely to be effective at addressing issues related to bias, discrimination, and inequity in the workplace, as they're able to see things from a variety of perspectives and respond with sensitivity and compassion. Have you ever had that experience where you were trying to convey what you were feeling or thinking or experiencing in a moment, and somebody negating it, dismissing it, not necessarily to hurt you, but more because they didn't have that lived experience themselves? You know, when we talk about privilege, and we don't realize the privilege that we come to each of our positions in life with and how we got to that space. So there's a workforce that you want to connect with as a leader that may indeed be very different than your lived experience and have different experiences than you have. So if you can create a sense of belonging and inclusion for those folks in all aspects of how they might identify, then they're going to feel more committed to the organization and to you as their leader, because they're going to have safety there, right? How might that impact the policies and procedures that you create or that you enforce? In championing and prioritizing diversity, equity, and inclusion, and as you create that culture of inclusivity, your policies and procedures for both staff and residents will take that new vision on, because you'll have to have a way to enforce that culture. So what are 3 ways to include, or 3 ways diversity, equity, and inclusion improves engagement, recruitment, and retention? Creating a sense of belonging, expanding your talent pool, and fostering career development. So when we create a workplace culture where employees of all backgrounds feel valued and respected, and we foster that sense of belonging, impacting the engagement. Now we have a wider range of tools that maybe somebody wants to go on and advance their career, and somebody who was not going to enter into long-term care as a long-term career goal, or nursing as a long-term career goal, even, that person has opportunities then and is reinforced in that career trajectory, right? They get unique experiences and skill sets to build on. And if your organization provides opportunities for educational reimbursement, then that person has a career opportunity to advance their career and career development as they progress throughout their healthcare career. In terms of diversity, equity, and inclusion, what we're sharing with our clients right now is there are 5 DEIB trends that are not providing the value that they once were perceived to provide. Hosting mandatory one-off DEI trainings. While that initially checks off a box, it doesn't change the culture of the organization, and it doesn't foster more inclusion. What it does is says, you know, we've done this training. That's one step. Expecting an employee resource group, larger entities have employee resource groups that are geared toward each of the individual diverse groups within their organization from a staffing perspective, right? So you might have an LGBTQ group, or you might have a different ethnicity or culture group within the organization. Expecting that employee resource group to tackle the issues or create solutions to the challenges that are faced, it's not easily achievable because the staff doesn't have the experience or the bandwidth, and they only come to the experience with their personal lived experience versus having a depth and breadth of knowledge in terms of best practices across all organizational spaces. So you're getting a skewed view of what the employee resource group needs. It's valuable, not that it's not valuable, but they don't have the bandwidth to tackle all of the issues and create systems and processes to help you to overcome them. Another DEIB trend that's retiring is insisting that only people of color lead DEI efforts, or only LGBTQ people lead a DEIB effort for that. There is value in having a multitude of lived experience, and people who have only one perceived experience that might negate all of their other lived experiences or skill sets. So, and truthfully, from an organizational standpoint, you could be hiring 4 or 5 different DEI folks to address your DEIB efforts. Then you have no strategic, cohesive strategy to move forward. Lackluster support of DEIB leaders, of DEIB from leaders and accountability. So if the order comes from on high to include diversity, equity, and inclusion, and then patient-facing staff or mid-level management begins to implement that, but there's no buy-in from the leadership and no accountability for what's been implemented, it's an act in futility. And lacking a cohesive DEIB strategy. So people will kind of throw spaghetti at the wall and see what sticks. That's not going to provide you any valuable outcome. You won't have valuable key performance indicators to measure. There's no idea of what the actual culture is versus maybe doing a strategic plan and doing an initial cultural assessment, identifying where the areas of opportunity are, and then strategically creating a plan for how to get there. So those are 5 trends that we're recommending people retire. And we're really encouraging folks to focus on these best practices. Switching to empathetic leadership. creating that psychological safety and safe place for people. It sounds like it's a lot of work and time consuming, but receiving people where they are and creating that safe space for them will save you more time in the long run than not doing so in the upfront. So being available, understanding that you might have one lived experience, that doesn't mean that that other person's experience is not happening or not perceived to be happening. Including DEIB in your branding. So I say that with one caveat. The caveat is this: please do not say that you have a diversity, equity, inclusion, and belonging focus or process within your organization if you do not have a strategic plan and are not methodically working that plan. Because putting that in your branding, while it will absolutely bring you more employees from different diverse backgrounds, and it will bring you more residents, it could unintentionally backfire if you don't have systems and processes in place to support that diverse culture that you're expanding to. Making everyone accountable for DEIB initiatives. It is not just one person's issue. Sometimes you'll hear that there's a chief diversity officer. That one person cannot change the entire organization. So change starts at the leadership and comes down. So we create the culture as leaders, and then we create and elevate awareness. So we teach our staff that are working with us to uphold and live the culture that we've created. But it starts with you as the leader. And then analyzing your DEIB data through talent lifecycle. So what does that mean? So when's the last time you sat and looked at your internal talent, your internal stakeholders, and looked at how diverse is that talent pool? Do we have the best of the best? And how can we improve that? And how can we bring other ideas and values to the table? And then how long are those staff staying, and how engaged are they? So very often when we're working with clients, we'll look at that piece through their employee engagement surveys. We'll make sure that we're including diversity, equity, inclusion content and value in their employee engagement surveys. And the 10 worst things that can go wrong when trying to do the work in-house. So number 1 is lack of leadership buy-in. Number 2 is poorly defined goals. What are you trying to achieve? Exceeding budget. Competing priorities. One person thinks this is a priority, one person thinks this is a priority, and then you hit a stalemate. We had that recently with one of our clients. Tight resources. And I have every belief that in long-term care, resources are very tight. So how do you do that on a budget? There are ways. Inexperience and lack of accountability lead to deprioritizing diversity, equity, inclusion, and belonging. So not knowing, my dad gave this really great example years ago, and I always think of it. We had back in the day when we had oil heaters, and my dad would say, the repairman would come in and, he would think there was something big and wrong with the heater, and he would get his hammer out and he'd hit that oil heater exactly where it needed to be hit, and bam, the problem was solved, right? Whereas my dad could have spent hours trying to fix, with the knowledge that he had, taking the cover off that oil heater and trying to get in there to troubleshoot it, and not knowing really what the problem was. And sometimes you see that with cars. The same thing happens with diversity, equity, and inclusion. The inexperience and lack of accountability means that sometimes people deprioritize it because they just don't even know where to start, or it seems cumbersome. A failure to create an infrastructure that supports the organizational change. So if the organization is not set up with systems and policies and procedures and training, you cannot sustain that inclusion effort. The other challenge is, and worst thing that can go wrong, is creating a homogeneous workforce. It limits creativity, innovation, and growth. And you don't want that. Delays due to internal resistance and policies. So we've always done it this way. Well, why have we always done it that way? Well, this is the policy. Well, policies can be changed. And then why don't we want to change the policy? And exploring what is it that makes us uncomfortable? Because if there's a policy that makes us uncomfortable and changing, we need to understand our own unconscious bias and how we might be feeding into that unintentionally. The inability to obtain desired result and key performance indicators. You know, how many times have you said, we've hired somebody for diversity, equity, inclusion training or cultural competency training, and we didn't see any return on the investment? A one-off training does nothing to change the behaviors. So you're not going to be able to measure any improvement. Systemic inequity blocks marginalized employees from accessing critical career growth opportunities. So equity means that everybody has a place at the table and it's equal, right? We all have an equal voice and we have equal opportunity. That equal opportunity might be different for each person. And so we have to level the playing field a little bit. Ineffective talent acquisition and management can negatively impact demographic makeup of the organization. And that can ultimately negatively impact your internal and your external stakeholders. So do all of your staff and residents look the same? And why? And what can you do to improve that? When you look at the demographic pool that you can, radius that you're pulling your residents from or your patients from, you know, are you in your demographic area, are you just pulling this one demographic? Or are you able to pull a wider pool of people? And sometimes that's, you know, so-and-so referring to you because they know that you have an organization that is inclusive from a cultural perspective versus somebody that has, you know, you have a case manager in a hospital or an insurance company, and they know they have an LGBTQ person that needs to go into a facility, but maybe they know that or perceive even that the organization is not inclusive, they may refer that person someplace else. So if the goal is to keep the building filled and staffed, then we need to do what we need to do to increase that opportunity for us along the way. So internal and external stakeholders. So I'm going to stop here because I want to open it up for questions. And I want to make sure that you have opportunity to explore any burning question. But my first caveat is this: anybody that asks a question in this space, my request is that we make sure that there's psychological safety so that every person can ask whatever they feel is important without a judgment. So that is my one ask.
So Dina, it's Kristen. Hey, great
Hi.
job. We already have a question in the queue that I'll go ahead and put out there for you as people are, just a reminder to use the question box at the bottom of your screen that we mentioned earlier. But in the meantime, while folks are thinking about and posting their questions, the question that we have is, how do you suggest implementing a DEIB program in an established community with today's current political climate?
That's a great question. Thank you for that. I think that there are, I understand the political climate. I also understand best practices. And so best practice is creating an area of inclusivity for both staff and the residents. So is your concern more, if you could please clarify it, is your concern more from a resident and patient care standpoint or from a staffing standpoint?
Staffing is the question, is the response.
Oh, interesting. Okay. Well, so I think that people are allowed to have their beliefs. And yes, there is a divergence in opinion politically about where folks might be. I don't think that should really impede your ability to bring on qualified employees and staff and create a culture of safety for them. So that would be regardless of, especially now in today's day and age where things are so tenuous, people are reluctant to work for organizations where they might not feel that they're safe. You can create that psychological safety for your employees, even through your policies and procedures. Larger healthcare organizations do it all the time. Fortune 500 companies do it. Fortune 100 companies do it. And I think when you create, you can hire anybody. So what you're really saying is, from a staffing standpoint, if the hesitancy is implementing a diversity, equity, inclusion, belonging, what about that seems scary? Because you're expanding your talent pool and you're setting a level of expectation for how we're going to treat people. And that doesn't mean that you are focused on or necessarily even personally support. You can have a different opinion personally, and you can recognize the value benefit as a leader to your organization, right? You can have your own personal belief system. Your personal belief system, though, and your business mind are separate things, right? So as a leader, if I know that I need to make all of my staff welcome, then I'm going to set the expectation. So look, everybody's going to play nice with everybody. That general thing doesn't work. Making a statement that we're going to be kind to everybody, that's a nice idea. However, there are ways that people don't even realize that they're not being kind to somebody else. So let me give an example. If you're concerned about hiring an LGBTQ plus person, I would ask you, might throw this out, what's your perspective on the generational cohorts? Because as the generations become younger, more and more of those folks are identifying within the LGBTQ plus community than outside of it. And for example, a study just came out, a Gallup survey just came out that showed that Gen Z is identifying at a rate of, I think it's 19.7% from that study identified as LGBTQ plus, whereas Gen X identifies at a rate of about 3.5%. So if you're not creating a culture of inclusivity, your ability to pull in that younger talent pool is going to be limited, and their expectations are going to be greater of you in creating that culture of inclusivity from all aspects, not just from LGBTQ plus, but from ethnicity, race, all areas. I hope that answers the question.
I don't see any other questions. Oh, thank you. The response was thank you. I don't see any other questions in the queue. I will just kind of just my feedback. It's interesting, your presentation, you were talking about just how kind of listening and hearing people and meeting them where they are. We were just having a long discussion about that earlier today, about how much that impacts your employee engagement and getting your employees to be more and feel more part of the team, which can contribute to improved quality, contribute to retention. So, I think that was this, I think this really was very timely, a lot of conversations that we're having, not just from a, diversity inclusion programming standpoint, but just improving your quality, improving your communication, and, kind of meeting people where they are, as opposed to what we're used to traditionally, kind of, this is what we do. I just thought it was really timely, and I appreciated your remarks about that. So I just wanted to say that.
Oh, I appreciate that. Yeah, I think in healthcare, we think about that all the time from a patient perspective, right? We meet people where they're at and we receive them and we try to do the best care that we can do. And the nurse in me always wants to make that person's life better in some way, right? You want to make a positive impact. And I've always thought that as a leader too, right? How do we make a positive impact for the people and that we work with? And am I creating a space where folks can come and say what they need to say respectfully? I mean, you can certainly give a difference of opinion and be respectful at the same time. And sometimes if we lead with a curiosity, an open curiosity, then staff will let us know, or people will let us know where they're at. And sometimes one's lived experience is not what you think it is. I met somebody yesterday. We were on this call, and he was sharing with me that he has a different identity, and he was a younger gentleman. He was in his 30s, and I said, "Well, tell me what you mean by that. You have a different identity." And outwardly, he appears like a straight white man. Is how he outwardly presented. What he shared with me is that he did not identify in that same way because he was a refugee from Bosnia. And he came here in 1996, and he lived a different culture and a different experience. And so he did not identify with seemingly similar counterparts within our American culture. And I thought it was interesting that he, number one, was comfortable enough to share that. And number two, that he was comfortable enough to share how it impacted him on a professional basis and who he chooses to engage with. So as an employee, he's looking for a company culture that will accept him and all of his aspects of his identity. And so if we've lived a place of privilege in one way or another, and we don't realize it because we've lived that, we've not walked a mile in somebody else's moccasins, we might not know what that is. And so when you create that safe space, they can share that. And then you can find a curiosity that creates new awareness in you to improve things.
All right. Well, if there are no other questions, I will go ahead and wrap everything up. Dina, I want to thank you for your presentation. Really appreciate it. Great information, great insight, and I think good tips for our participants. So just a reminder to everyone that we did record this webinar, and it will be posted on the FHCA website as well as on our Caregivers Florida website, which is florida.carefortheaging.org. And we want to thank you all for participating, and we will see you again soon.
Thank you. If anyone has a desire to join our executive forum on March 28th at 2:30, please email me and let me know.